is going to be for us to have x-rays and molds of her teeth. That way we can do a plan and decide what's going to be best. Now what I will do today is to go over with you how it works if we have to be considering doing some treatment. Now oftentimes where we have a situation where the teeth are too far forward and our plan is to move them back, that normally will call for taking some teeth out, okay? Because it requires getting some space in order to move the teeth. Now the first appointment, what we're going to do is to set up a visit, which will be very short, for us to create a small space between where the teeth meet, all right? Creating that space is to allow us to be able to fit the band, which is this, around each tooth, okay? So I'll show you how we create the space. We're going to set a short appointment up, which usually takes about 2 minutes to do, to have a rubber band, which is called a spacer, placed between the teeth. So this is a spacer here, and what we are going to do is to use a plier to stretch it and then slide it between the teeth. All right, very easy appointment. Now once we have the spacers in, they stay there for 1 week so that we get enough room. All right, spacers do feel a little bit uncomfortable. So what that means is that you should have a soft food diet for a couple of days. So you'd use things like mashed potatoes or soup, anything that is not too uncomfortable, all right, for when you're chewing. Sometimes the spacers do fall out if they create a lot of room. So if they fall out, just let us know and we will tell you if they need to be replaced, okay? So remember, it's 1 week with the spacers in, and when you return for your second visit, the spacers are removed so that we can then fit the bands, all right? So once we've got the bands on, we're just sizing them to make sure that they're the right fit for you, okay? Once we have the right fit, we then take a mold of the teeth. That mold is done to get the shape and size of your mouth, right? So that when we're actually making your holding arches, remember these, we're going to be making them to fit you, all right? So once we've got those made, you then come in for one more appointment, and again, that's a week later. And at that time, we're going to be putting everything on, okay? So we're placing these, and they're going to be cemented to your teeth, so they're not removable, okay? And at the same time, we're going to be putting on the braces. Now, this does mean that it's going to be a long appointment for us to put your braces on. It's not going to hurt, though, but it will take about 1.5 hours to 2 hours, okay? So, how we do that? First, we're going to get your teeth prepared for the braces. That involves polishing your teeth, rinsing them off, then brushing a seal coating over each tooth so that we can stick the brackets on, all right? So this silver stud here is what we call a bracket, right? Now what that bracket does is it holds on to each tooth, okay? Now you need to have one of these on each tooth, so this is a full set of brackets here, right? So that's what it looks like when you have a full set of brackets on. Now the brackets don't work by themselves. We then have to put something in that will actually cause the movement to happen. So in the brackets at the top as well as the bottom, you're going to have an arch wire placed, which is this wire here, and that fits into each bracket slot, okay? What that does is to then apply a very small amount of pressure, and that pressure is what causes your teeth to move.